I think what Dr. Livingston was really talking about is that when you do that blood test to see if you were inherited or if you were born with one of the defective BRCA1 or 2, sometimes there's, the way I describe it is, let's say the gene is like a word and it's got letters. Sometimes one of the letters is changed, and that's going to cause cancer, and sometimes one of the letters is changed, but it really doesn't have any effect on the way the cell works, and you're not at risk, higher risk for cancer. So I think that was the sort of maybe he was talking about. When we're talking about actual breast cancers that may or may not act like the breast cancers that happen in these women with the defective genes, this has been a journey and a story, and I wish Judy Garber were here because she's very, very involved in this story and leading the way. So let me tell you one thing. The breast cancers that happen in the women with the BRCA1 abnormality, they're almost always do not respond to estrogen. They are estrogen receptor negative, and they don't have this HER2 protein that Nancy was talking about. So they have a fancy name. They're called triple negative. And right now, trying to find that 15% that might respond to these exciting, wonderful treatments, what we started with is looking under the microscope. We're trying to pick ones that look like these BRCA1 breast cancers, that they don't have the estrogens, that they look the same. In fact, African American women have that type of breast cancer, but that's not the whole story. That's just the tip of the iceberg. So what people are looking at now is to actually look at the function of that BRCA1 gene, because it may not work because you've inherited a faulty gene, but it may just not work in the cancer. It may not be that you've inherited anything from your mother or father, but maybe that BRCA1 gene is just not working in the cancer. And if that's the case, your cancer may also potentially benefit from these effective treatments. So I think that's the way to think about it. That we've started with how they look, and now we're trying to get in, and that's what I was talking about. Andrea Richardson is doing, she finally came, a lot of this work, really trying to look at how it's functioning and find the molecular inside the cell, which ones are looking and acting like the BRCA1s.